All right, December 21st is the winter solstice and the official beginning of winter. It's also the day with the fewest hours of sunshine or daylight. Winter's shorter days can trigger a form of depression called SAD, or seasonal affective disorder. For some people, it's more than just the winter blues. Trust me on this. But you don't have to tough it out. Dr. Adriana Pham joins us now with some strategies to cope with SAD. She is a director of psychiatry consultation at Hackensack University Medical Center. Dr. Pham, good morning to you. How are you?
Good morning. Thank you for having me.
Okay, so what causes seasonal affective disorder, and just how serious is this condition?
So it's a type of depression. So depression can affect your life in many ways, right? It affects the way you think, you feel, it affects your functioning. So this type of depression comes about the late winter, late fall, early winter, when, as you mentioned, the sunlight is less and less during the winter days. So this type of depression comes with very low mood, kind of a sense of lethargy and fatigue. People feel like almost like hibernating. They tend to overeat, oversleep. So the exact cause is not well understood, but we believe that the lack of sunlight decreases the amount of a neurotransmitter called serotonin. So serotonin is a neurotransmitter, is implicated in mood, in sleep, and in appetite. There's other causes, for example, melatonin, overproduction of melatonin. So we've been hearing about melatonin, and we know that it promotes sleep. So maybe that's a reason why people feel that sense of lethargy. Now, this less sunlight can affect the circadian rhythm. So our body clocks are kind of disrupted by this low sunlight in general during the day.
So some of the symptoms, and just touching upon some of the things that you just mentioned now, I'm going to list them for the folks at home: low energy, craving carbohydrates and overeating, and disordered sleep patterns. Are there any other signs that indicate this is more than just the winter blues? I know you talked about a few, but I just, again, want people to be able to see this.
That's right. So the severity of the depression, right? So when we call the winter blues, it's just that sense of lethargy, isolation, feeling like you don't want to be outside too much, you don't want to socialize with people. When it becomes so severe that basically affects the way that you are functioning, that's when we're really have to think about other types of treatment. If it really is affecting your daily life, you have to think about treatment.
Is there a group of people that you think are more at risk than others to be affected by SAD?
Sure. So it matters where you live, right? So you mentioned the far and northern states like New England, Alaska, with in general less sunlight during the year, are going to be more at risk of developing seasonal affective disorder than people who live, for example, in the southern states like Florida. We also consider at risk of people who already suffer from seasonal affective disorder, or people who suffer from general depression, or even bipolar disorder 1 and 2. We know that this disorder can run in families, and we also know that other disorders can be comorbid, as we call it. So, for example, anxiety disorders, eating disorders, ADHD can also be prevalent in these patients who have this tendency of suffering from SAD.
I want to get to some of the strategies that you recommend to help people deal with SAD. The first one is get more light, either naturally or use a light box.
That's right. So we talk about these, people already know about the light boxes, so the light therapy boxes. So basically the purpose of these boxes is to provide or to imitate the natural sunlight that we will get during a regular day. So those light boxes provide a white fluorescent light that has to be on certain lux. So it has to be around 10,000 lux in order to be beneficial for you. So, but if you don't have that light, which we also have to consult with your physician before using it, get as much natural sunlight as much as you can.
Just get that face. Just get that face outside. Take that walk. That's just get outside. I got to be quick with these other two, but I want to get to them. Eat more foods with vitamin D. What are some examples?
That's right. So, for example, salmon, eggs, green vegetables, mushrooms, all these things that produce vitamin D, because it's going to be low in the winter months.
And also, you say, finally, stay in touch, resist that urge to isolate. I know you kept talking about isolation before that can really, really bring on these symptoms, but why is this so important?
So always socializing is very important. That sense of hibernation is not going to be good for you. So try to continue to get in touch with friends, to do things outside, even if it's, during the dark hours. Resist that temptation of being inside and isolate yourself. Please just stay in touch with friends and family during these months.
And don't look at the calendar because spring can look like it's so far off. Doctor, thank you very much for taking a few moments. Happy holidays, and thank you for joining us.
Thank you so much.
All right, Dr. Fan, thank you very much. One bit of good news is now from every day, it gets a little bit longer, a little bit brighter until spring is on that horizon. So just hang in there, but do take some of those tips to heart.